Hello, my name is Paula, and the procedure that I had with Dr. Shoemaker was implants and crowns. I had a mouthful of crowns that were failing, and as far as I was told from my other dentists that I saw, there wasn't anything else they could do. They felt like I was at the end of my road and really indicated that I probably needed to just get my teeth pulled.
Paula was one of our younger patients that comes in with major dental problems. She was in her mid to late 30s. She had a mouth that had been fixed more than once, and she was at a point where she was just ready to say, just take them out. I'm tired of going to the dentist and getting stuff fixed.
I needed someone that wasn't going to tooth shame me and make me feel bad about my teeth and where we were.
The problem was Paula was too young to have all her teeth taken out, and her teeth were fixable. She had some very good qualities about her. She just needed her teeth fixed. So for Paula, we did quite a bit of, I will say, general dentistry, in that root canals, crowns, and she has lost a couple of teeth, and we replaced those with implants. So she still has all of her teeth. She's in great shape. Yes, she may need work over the next 10 years, but so much better than taking all of her teeth out at such an early age.
They look and feel just like my teeth. I can't tell a difference. That's a wow factor, big time, to know that and to laugh, because I laugh with my mouth open. You can't tell the difference between my teeth and the implants at all. It just matches. It's amazing what they can do.
I love implants. It's the best tool we've ever had in dentistry. Absolutely the best tool. Nothing solves more problem than implants. When you're the caregiver of a piece of real estate, the mouth, your goal is to, how do I make this mouth last 50 years, 60, 70, 80? One way is to not bail ship too soon. So it's really knowing when to step in, how aggressive to be on these patients before you take everything out.
Since my procedures, I feel so much better. I'm happier. I'm in a really good place now that I have my implants.